I'm here today with Dr. Brad Lane, and he is an optometrist at our Appalachian Eye Care in Princeton, West Virginia. And he's here today just to talk with us a little bit about his career and his line of work and just give us a little bit of information. Thank you so much for joining us today.
Absolutely. I'm happy to be here. Thank you.
We really appreciate it. So, I'm going to start out just asking you, tell our high school students just a little bit about what your typical day is like as an optometrist. And I know every day is probably different, but if they're interested in this type of career, what can they expect?
Sure, absolutely. Yeah, a lot of times, I guess people think that optometry is only glasses and contacts, helping people see better, which is a huge portion of what we do. Um, I would say in a day that probably consumes about 75 to 80% of my patient encounters. But then we also do a lot of, well, of course, obviously patient education, but then diagnosing ocular disease, like if you've heard of things like macular degeneration, cataracts, glaucoma. We do a lot with folks that have diabetes because diabetes can affect the back of the eye. So there is a lot of things that you can do that's more than just glasses and contacts, but it's all ocular health, just making sure that the eyes are healthy. Yeah.
Can you tell us a little bit about your schooling and background that you had to go through for this career?
Sure. So, all the way back to high school, right? I made sure I took a lot of science classes, lab classes, math, and then in undergraduate, I went to Concord and majored in, I actually majored in psychology to start and figured out that's not what I wanted to do. So then after I finished that degree, I re-enrolled and did pre-med. So obviously a lot more math, biology, anatomy, calculus, trig, a lot of those science classes. And then, so there was 4 years of that. Well, it took me a little longer since I've wasted a little bit of time, but, and then there's 4 years of optometry school. So I went to optometry school in Philadelphia. That is, it's pretty intense. It's sometimes 6, 7 days a week classwork. And then you do rotations. You go out and you work in the field at different hospitals and veterans hospitals, and then private practices.
So definitely a commitment.
It is. It is. It's at least 8 years of college you're looking at.
Right. So it's definitely something you want to make sure that you're interested in. So how did you get interested in this field?
Well, a few things. I mean, growing up, my vision was terrible. So, before, like when you're sick, you go to the doctor, or if you go to the dentist, it's crazy. It's like, I brush my teeth all the time, and it seems like I always had a cavity. My sister, she probably wasn't the most diligent on brushing her teeth, and she never had cavities. So, but when I went to the dentist, it was always painful. If I went to a doctor, I was sick. It either involved like some sort of medicine. I hate taking medicine, especially liquid medicine. But when I went to the eye doctor, there were no injections. There were no, syringes. There was no drills, and it's kind of like, hey, here's a pair of glasses, and I can see better. I'm like, this is awesome. So I always kind of had an interest with that. And then once I was in college, and I figured out I didn't like psychology, I went and shadowed a bunch of different professions, and the guy that I shadowed, the optometrist, he was able to kind of the same thing I was saying about just help people without, medicine necessarily for that. And then the other thing is he was able, the first day I was there, a lady came in for just a regular eye exam, and he looked in the back of her eyes and did a couple things, and he found out that she had a brain tumor just by looking in the back of the eyes. And she had no clue, but he saved her life just by doing an eye exam. So that really intrigued me. So that's what made me really interested.
Yeah, I would say the eye doctor is probably my favorite doctor to go to. It's definitely the easiest of all.
It is by far, yeah.
As far as the patient is concerned, not as far as the doctoring side of it. What would you tell our students would be the most challenging thing about your career, about your job?
Yeah. Well, when you have to give bad news, like that situation I just spoke about. A lot of, someone comes in thinking they're getting a regular eye exam, and you have to tell them, hey, I think you have a brain tumor. That's not easy. Then also telling someone you're probably going to go blind. There a lot. That's probably one of the hardest things, and a lot of studies and surveys have shown that people would rather lose a limb than go blind. People would rather lose any other sense than go blind. And unfortunately, it happens. And when we have to deliver that news, that is by far the worst thing. That it's very upsetting to have to tell someone that. Luckily, we don't have to tell them that often. There's a lot of things we can do to really help folks so they won't go blind.
So what would be some of the rewarding aspects then?
Well, and I keep going back to that case with the brain tumor, which I've had several patients that I've been able to catch a brain, to find out they had a brain tumor through that. But whenever you find out and you get them treatment and they are a survivor, that's awesome. When there's a 12-year-old, teenagers maybe really struggling with being accepted, and glasses might be, you're a nerd or whatnot, and you fit them with contacts and you can just see them light up, their face light up. That's really rewarding. Other folks say someone who might be struggling in school, you get them the correct prescription, they can see better, their grades improve. Those things, those are good days in the office. Yeah.
Absolutely. So give us some advice for our students, either just advice in general for high school students, or maybe advice for those that think they may want to pursue this type of career. What would you say to them?
Sure. Well, shadow. I mean, go out there and find out what you want. I mean, if you think you might be interested, shadow. The way that I knew I didn't want to be a family doctor is I shadowed. The way I knew I didn't want to be a dentist is I shadowed. And then take every science class it's painful. Sometimes I know in college, genetics is painful. I know that. Organic chemistry, it is not fun, but it's worth it. And don't give up. I mean, if you really want to go for it, go for it. Don't let anything slow you down. And then just if in particular for eye care, come by. If we're open to having folks shadow us at any time, just get in touch with us. You're more than welcome to come by and hang out for a while and see what it's about.
Very good advice from Dr. Lane at Appalachian Eye Care. We thank you so much for taking your time. I know you're super busy, and we appreciate you so much.
Absolutely, no problem. I'm happy to help anytime. Thank you.
Thank you.